Hi everyone, I'm Dr. Shiva Araya, and today I'm in Maui with my mum. And mum's going to help me discuss hypertension with all of you by asking me a few common questions that people may have about the topic. So thanks for joining me on the video, mum.
You're most welcome, Shiva.
Alright, so what's your first question about hypertension?
What is hypertension?
Well, hypertension describes a condition in which there's high blood pressure in our arteries based on blood flow and resistance to that blood flow.
What is an artery?
An artery is a blood vessel. It's essentially a pipe that originates from our heart carrying blood containing oxygen and nutrients and supplies it to all parts of our body.
What does hypertension result in?
Hypertension results in damage to those arteries by causing the walls to become hardened and more fragile, increasing the risk of obstruction and potentially bleeds as well. So things like heart attacks, strokes, kidney disease, or even visual impairment as well.
What are the symptoms of hypertension?
The tricky thing is most people don't have any symptoms for hypertension, and it's often detected on just a checkup. But if blood pressure becomes quite high, then it can cause things like headaches, chest pain, shortness of breath, blurred vision, and even nosebleeds as well.
Okay. How often should people get their blood pressure checked?
Well, given that people don't often have symptoms, they should get it checked every 2 years, but if they have a risk factor, at least yearly. And some kids have a higher risk of developing hypertension, and they should be guided by their pediatrician about the intervals for a checkup.
What are the risk factors for high blood pressure?
Oh gosh, there's so many. There's age, there's ethnicity, family history, there's excessive weight or a sedentary lifestyle, excessive sodium intake, smoking, excess alcohol, drug use, certain medications, and even stress. But there's also secondary causes for hypertension, such as obstructive sleep apnea, kidney disease, heart conditions, or even adrenal gland tumors.
What is a normal blood pressure and what does that number mean?
The normal blood pressure is 120 on 80, and that first number represents the pressure in our arteries when our heart is contracted and has pumped blood through those arteries. And the second reading is, or the second number rather, is the pressure in our arteries when our heart is relaxed. So kind of in between a heartbeat, if you will. 120 to 139 is normal, 80 to 89 is normal, so normal to high normal really. And 140 on 90 is considered a high blood pressure reading.
What is the next step?
Well, if you have a reading of 140 or 90 and above, then your doctor's likely to check your blood pressure a couple more times on the spot. And if there's any doubt as to whether you have hypertension, they're likely to get you back in a week's time, or get you to do a 24-hour blood pressure monitor, or keep a blood pressure diary and bring it back in for them to have a look at. They may consider doing things like blood tests, urine tests, and an ECG as well.
How is it managed?
Well, it's managed by looking at lifestyle modification, so looking at reducing all of those risk factors, so increasing exercise to 150 minutes per week, reducing salt, reducing weight, reducing alcohol, quitting smoking, reducing stress levels. That's just to name a few things. But we could also then look at medication if it's recommended or necessary. And there's lots of different classes of medications we can use. And within each class, there's lots of different options as well. And the aim is to treat people in a way that is effective without causing side effects.
Good. What is your main message?
Look, my main message is that hypertension often doesn't have any symptoms, and it causes damage over a period of time to virtually every organ in our body. And all of that is preventable by just getting a checkup. And by getting that checkup, you could potentially have a longer lifespan and a better quality of life. And that's pretty much it.
Okay, that's good. Very, very informative.
Thanks, Mum.